According to the Centers for Disease Control and Prevention, the Aedes aegypti and other mosquitoes have a complex life cycle with dramatic changes in shape, function, and habitat. Female mosquitoes lay their eggs on the inner wet walls of containers with water. The larvae then hatch as seen in picture 1 when the water inundates the eggs as a result of rains or other addition of water by people. In the following days, the larvae, seen in picture 2, will feed on microorganisms and particulate organic matter, shedding their skins 3 times to be able to grow from 1st to 4th instars. When the larva has acquired enough energy and size and is in the 4th instar, metamorphosis is triggered, changing the larva into a pupa, as seen in picture 3. The pupae do not feed, they just change in form until the body of the adult flying mosquito is formed. Then the newly formed adult emerges from the water after breaking the pupal skin, as seen in picture 4. The entire life cycle lasts 8 to 10 days at room temperature, depending on the level of feeding. Thus, there is an aquatic phase and a terrestrial phase in the Aedes aegypti life cycle. The aquatic phase consists of the larvae and pupa, and the terrestrial phase is with the eggs and adults. There is a very important adaptation of dengue vectors that makes controlling their population a difficult task. Their eggs can withstand desiccation for several months, which means that even if all larvae, pupae, and all adults were eliminated at some point in time, repopulation will occur as soon as the eggs in the containers are flooded with water.
Incidences: 50 to 100 million dengue fever infections per year globally, 0.5 million cases of severe dengue, dengue hemorrhagic fever or dengue shock syndrome, 100 to 200 cases annually in the US. And finally, the average case fertility is 5%. Risk factors: living or traveling in tropical areas. Being in tropical and subtropical areas, risk of exposure to the virus that causes dengue fever, especially high-risk areas are Southeast Asia, the Western Pacific Islands, Latin America, and the Caribbean. Secondly, prior infections with a dengue fever virus. Previous infections with a dengue fever virus increases your risk of having severe symptoms if you're infected again.
The 2 types of tests available for dengue is the antibody test and the molecular testing. The antibody test is used to help diagnose a current or recent infection, which involves 2 different classes of antibodies which is produced by the body in response to a dengue fever infection. These are the IgG and the IgM. The molecular testing, however, is detected through the genetic material of the dengue virus in the blood up to 5 days after symptoms onset.